While you are sleeping, many people in our community struggle with mental health episodes. It's why the McNabb Center opened the first emergency psychiatric assessment, treatment, and healing unit, or EmPATH unit, in the state of Tennessee last year. It provides care around the clock. Here's a look inside at the night shift.
It is a completely different world.
When Nicole Skinner steps inside the McNabb Center's EmPATH unit for her 12-hour overnight shift, she never knows what to expect.
Night shift, it's interesting because you get a different type of the community, I guess a different flavor of the community.
As a master's level clinician, she's the first to greet patients who come in for a mental health crisis.
The ER is a little scary, but that's been the main place people have been told to go to before. And when EmPATH came along, that gave them a different opportunity to have a safe space. And not everyone gets that at night.
But because the EmPATH unit is always open, people can come in for up to 23 hours to meet with medical professionals like psychiatric nurse practitioner Stephanie Hawkins.
Because of the crazy hours, you wouldn't think that we'd see a whole lot of traffic, but we do. Sometimes they just want to talk. Sometimes they need some sleep because they've not slept for days. Sometimes they need to sober up, but a lot of times they don't need to be in jail. They don't need to be in the emergency room. They don't need to be, locked up somewhere. So people come in.
For people struggling with their mental health, Hawkins says nighttime can be especially hard.
Because I feel like it rears its ugly head on the quiet times in the night when you're trying to sleep.
It's why the EmPATH unit exists. Employees like Hawkins and Skinner meet with clients, give them mental health assessments, recommend resources, and provide a safe place for them to rest.
I get to have as much time with clients one-on-one. Sometimes people just want to talk and talk and talk just to get it out. And I like to be there to listen or to help them.
I think it has a lot of benefits to helping the community and just kind of bridging that gap of care that for the longest time was kind of handled in the emergency room.
Care they say is needed no matter the hour. In Knoxville, I'm Sam Perez.
That was Sam Perez reporting. If you'd like to see more while you are sleeping stories, you can scan this QR code.